Some people suffer from heart-related health problems, and some may need to receive a heart from another person. Given that the global supply of donated hearts is still limited and scarce, many patients will not receive enough to cover their needs, or will not find a matching heart in time. Therefore, an immediate and available alternative is essential. Therefore, specialized researchers and doctors have begun developing a prototype artificial heart as a suitable solution. 1. Artificial hearts have been approved for use as a temporary solution for people in the final stages of complete heart failure until a donor heart is obtained. 2. So, what is an artificial heart? How does it work? Is it truly a successful alternative to a natural heart? What is an artificial heart? An artificial heart is a mechanical device designed to support a person's circulation. The ventricles, lower chambers of the heart, and valves are removed from the patient's heart and replaced with an artificial heart powered by compressed air. 2. Some of the most important things to know about the artificial heart are the following. 1. 3. Only one artificial heart design has received commercial approval from the Food and Drug Administration, FDA, despite 13 designs in use. Implanting an artificial heart requires a complex surgical procedure similar to that used for a donor heart transplant, which takes approximately 4 to 5 hours. The artificial heart is similar to the natural human heart. It represents the lower part of the heart, containing 4 valves and 2 ventricles. It beats like a natural heart, but it is larger in size. The artificial heart is designed and manufactured from a material that can withstand the stress it may be subjected to. It is biocompatible, meaning it can be placed inside the body. The possibility of using an artificial heart for patients aged 9 to 80. The ability to leave the hospital with an artificial heart until a donor heart is obtained, as the device's external power source can be carried. The external power source has batteries that can be used for 2 to 3 hours without being connected to a power source. Research on the artificial heart and efforts to develop it are still ongoing. It cannot currently be used for people with small body weight and size due to the large size of the implanted device. However, efforts are underway to develop it. How does an artificial heart work? The artificial heart functions exactly like a natural heart. It replaces the heart valves and ventricles and is connected to a power source outside the body. The artificial heart pumps blood through the main arteries connected to the heart toward the lungs and the rest of the body. It contains 4 valves that connect the device to the upper chambers of the heart, the atria, and the main arteries. These valves help control blood flow within the heart, just like valves in a natural heart. 4. The artificial heart is controlled by a controller placed next to the patient's bed in the hospital, or by a portable device that fits in a shoulder bag or backpack. It weighs approximately 6 kilograms and can be recharged at home or in a car. 4. Why is an artificial heart used? An artificial heart is used as an alternative solution for patients who are not eligible for a heart transplant or who are waiting for one. 5. The cases in which an artificial heart is used are limited to patients in whom medications or a left ventricular assist device, LVAD, have failed to provide satisfactory results. The artificial heart is used as a temporary solution until a donor heart becomes available. A left ventricular assist device, LVAD, is a small pump connected to the heart, performing the function of the left ventricle to pump blood, with the goal of preserving a person's life. The cases in which a doctor may resort to an artificial heart are as follows. 6. A heart attack that has affected a large portion of the walls of the heart's ventricles. Failure of the right side of the heart simultaneously with the left side. In this case, an LVAD alone is often ineffective. Diseases affecting both sides of the heart, such as some types of cardiomyopathy and amyloidosis. Complications resulting from a heart attack, such as a ruptured septum between the 2 ventricles. Success rate of artificial hearts. Artificial hearts have been used as a temporary solution prior to a donor heart transplant since 2004. According to Harvard University, the success rate of artificial hearts is approximately 80% in their ability to keep people alive until a natural donor heart is found. 6. How long can a person live with an artificial heart? Some patients have been able to live with an artificial heart for more than 4-5 years, but it is important to remember that this device is used as a temporary solution until a donor heart becomes available. 7. Effects of artificial heart surgery. Like any surgical procedure, artificial heart transplantation may lead to some complications, such as blood clots, infection, bleeding, and others. It is worth noting that due to the possibility of some complications, the patient may remain in the hospital under observation to prevent any complications and treat them immediately. In some cases, the patient can leave the hospital and continue their normal life until a heart donor is found. 4. Cost of an artificial heart. The cost of artificial heart surgery is estimated to range from $100,000 to $300,000 per patient in the first year. This estimate includes the surgical procedure, in addition to the fees for the control unit and device, and ongoing medical monitoring, according to a study published in the International Journal of Technology Assessment in Healthcare. 8. People who are not eligible for an artificial heart. The artificial heart is not suitable for everyone, as there are groups that are prohibited from using it. Its use includes 7. Small-sized patients, including children, infants, women, and small-sized men. People who can resort to other treatment methods, such as medication, as an artificial heart is used as a last resort. Heart failure affecting only one side of the heart. In this case, a ventricular assist device, VAD, may be used. Contraindications preventing the person from taking blood-thinning medications. The doctor may recommend taking such medications to prevent clots while the artificial heart is in the body. Advice after artificial heart transplant surgery. It is recommended to take the following advice into consideration after an artificial heart transplant while waiting for a donor heart. 7. Increase physical activity slowly and gradually. After the operation, the patient will notice an increase in the physical effort they can perform compared to what they were capable of before the operation. However, this should be gradual, and it is essential to follow the doctor's instructions regarding the exercises to be performed to maintain muscle strength. Follow the doctor's instructions regarding caring for the artificial heart and its power source, and take the necessary measures to prevent infection. Avoid getting the tubes inserted through the skin wet, and avoid using steam baths and saunas. Eat a healthy diet. 4. Be sure to visit your doctor regularly and undergo the tests he or she recommends. 4. Adhere to the medications your doctor recommends, such as blood thinners and some medications used to prevent infection. 4. See your doctor immediately if you develop a fever.